Hey, it's Hoyt, and this presentation is called Think Twice. It's geared towards young people, and it's on substance abuse. Statistically, 1 in 7 young adults have a substance abuse disorder, and the tragedy is that roughly 75% of these young adults will continue to struggle with their disorder on into adulthood. Um, Substance abuse is something most of us are aware of, but we never really take into account the true impact that these substances can have, especially on a growing brain. Um, Even though it can never really be proven, it can only be estimated. I think the majority of us would see these substances as counterproductive. So, an introduction, abused substances are those that chemically affect the body's central nervous system. Um, Addiction is characterized as a chronic relapsing brain, um, and it's sort of compulsive in nature. You're always after the drug. It's cyclical nature. Um, Dopamine. This is a neurotransmitter responsible for positive reinforcement. So this is your happy hormone. It's what gives you that reinforcement to keep doing things. And here, wherein lies the problem when you can just pop a pill and you have that feedback, that positive feedback, but you haven't essentially done anything like you would in an everyday task. Um, all of these substances will directly or indirectly alter levels of dopamine within the brain. These artificially created substances can cause dopamine levels to spike much higher and for longer amounts of time. Um, with prolonged exposure, the brain will stop responding to other natural sources of stimulation, like food, for example, which is crazy because that's something you need to survive. Um, while there can be acute dangers, substance abuse is a chronic illness because relapse is so common. And that's just crazy to me. Next, we have your medication classifications. I want to focus specifically on identifying the signs and symptoms of withdrawal for each of these substances because that's what you're going to see them manifest as. That's how you're going to be able to identify them. So, signs and symptoms of central nervous system depressants commonly include severe life threatening confusion, seizures, tremors, delirium. You'll see their face flushing, uh, severe anxiety, and an increase in blood and and an increase in blood pressure. Signs and symptoms of opioid withdrawal include dilated pupils. That's pretty specific to opioids. Vomiting, diarrhea, runny nose, extremely nervous, and an elevated pulse as well. So some signs and symptoms of stimulant withdrawal um, include apathy, so a lack of motivation to do anything, depression, generalized fatigue, suicidal ideations. You can even see those. Uh, you can see paranoia, irritability for sure, especially when they've been off it for a while. And so marijuana, uh, they have significantly fewer signs and symptoms of withdrawal than the rest of these medications, and they kind of overlap too, so it can be hard to differentiate. They include restlessness, generalized anxiety, and a craving for more, which is typical of most of them, so it can be hard to distinguish. Alcohol. So the National Institute on Alcohol Abuse and Alcoholism reported that alcohol causes 88,000 deaths per year. It's the number one most abused substance, and it's the third leading preventable cause of death in the U.S. To some degree, the negative effects are really immeasurable because it can affect how you drive later. You might get into a car accident Uh, we like there's because it's so prevalent in today's society. There's really there's no way to tell the full effects of that it's had. Um, so yeah, they're pretty wide ranging and include self injuries like car accidents, violence, sexual assault. Like there's no telling. Obviously, the more distillation alcohol has, the more of a depressant effect it's going to have on you. The depressant effect can become so severe that organs begin to shut down and sometimes fail. Um, so we have the CAGE questionnaire tool um, to kind of assess someone who could be an alcoholic. Have you ever felt okay? It's 4 questions, and the first one is, have you ever felt like you needed to cut down on your drinking? The second one is, have people annoyed you by criticizing your drinking? And the third one is, have you ever felt guilty about drinking? And the fourth one, number 4, is, have you ever felt you needed a drink first thing in the morning, like an eye opener, to steady your nerves or get rid of a hangover? Um, Sort of self-reflective questions there. And according to the CWA protocol, this is how we manage people coming off of, I guess, an addiction to a certain substance. And CWA stands for the Clinical Institute Withdrawal Assessment. So we're assessing for signs of withdrawal, and it's assessing for things specific to alcohol, like nausea, vomiting, tremors, auditory disturbances, paroxysmal sweats, visual disturbances, anxiety, headache, and orientation. If the CWAS score is greater than a 7, they will likely need medication as an intervention and they can't come off. If they didn't, then if it was lower, for example, then we might not even have to do the CWA protocol. Can't really see that. So substances, I've categorized them to narcotics and stimulants. Narcotics are used for pain relief, diarrhea, and cough. Naturally occurring substances are derived from opium, such as morphine. Synthetics are examples: methadone, meperidine, all the codeines, oxy, hydro. With regular use, you can expect to see constricted pupils, euphoria, and drowsiness. Like I said, that's pretty indicative of narcotics. So what you'll typically see is those wide mood swings with really high highs and really low lows. In case of an overdose, those pupils will be pinpoint and the respirations will be short and shallow. Narcan or naloxone is the reversal agent for this one, and you can actually have it in a pen and carry it around with you like an EpiPen. So stimulants are kind of like they sound. They overstimulate the central nervous system. They are typically used to treat ADHD, obesity, and narcolepsy. I've written down some examples here, like you'll see every day: nicotine, caffeine. Maybe you won't see cocaine and amphetamines every day, but those are of a more severe nature. Back in the 1950s, amphetamines were all the rage. Everyone thought they were the magic weight loss medication. And that's when their addictive nature was also quickly discovered, because they do make you lose weight, but it's not worth the side effects. Adderall and Ritalin are the most common amphetamines, and coming off them, people are very, very irritable if they don't have their medication. So there's no reversal for stimulants, which is why they're so dangerous. People overdose on these all the time, and there's no way to get the heart rate back down. Some common things you'll see with people who abuse stimulants is bad oral hygiene and bad nasal health, depending on how they're taking them. The signs and symptoms are fairly apparent. I mean, what's it like when you don't get coffee in the morning? Maybe not extreme irritability, but irritated for sure. Yeah. Go next slide. So we have treatments. Like I said earlier, Narcan is the reversal for narcotics. It is a prescription medicine used to treat the symptoms of opioid overdose and reversal of possibly respiratory depression and severe. Like, that's where you'd want to use it. That's where you can save someone's life. The key with all of these addictions is preventing the cycle. If you can detox a patient for 5 days, then they regain a sense of normalcy. 5 days, that's the marker for being able to regain their sense of self for a little bit. Clonidine is a sedative medication that is useful in treating various kinds of withdrawal just to get through that 5-day period. It may be necessary as a part of any detox if the patient becomes increasingly agitated and they're going to throw a big fit and threatening to harm people because they need their drugs now. And that's just the nature of the illness. So when we're looking at the patient, we're making sure to monitor their heart rate and blood pressure because they're going to be anxious and upset. You also want to be assessing for the regular signs of withdrawal with the CWA protocol, just like with alcohol. Like I said before, unfortunately, nothing as far as medication can be done for a stimulant overdose. Drug addicts will often use benzodiazepines to come down, which are central nervous system depressants, but this is extremely dangerous. Like, this is how most people die. And psychosocial treatments for addiction include cognitive behavior therapy. This is the best we have for stimulants, and dialectical behavior therapy. Yeah, so that's kind of where we're at as far as stimulants, because nothing else is going to be safe. With alcohol, we have these relapse preventing drugs. That's why it's considered a chronic illness, because relapse is so common. Probably the most popular is Revia or naltrexone. It blocks the pleasure centers of the brain that induce that intoxication high. When these are blocked, you're left with only the negative side effects of alcohol, which, again, is very disheartening to anyone who's trying to drink a lot. And Antabuse, or disulfiram, is one of the more interesting ones because it actually extrapolates the negative effects of alcohol to work as a deterrent. So not only does it block the high, but it makes the negative effects worse to, like, in a crazy severity. It blocks the normal breakdown of acetaldehyde to acetic acid, which leads to toxic effects within the body. And something even like rubbing alcohol, getting on your skin, can start to show some of these negative effects, which is pretty crazy that people are put on that and willingly agree to that. But hey, whatever it takes to get you off of your abused substance. All right. So I know we talked about the DSM-5 criteria in the schizophrenia video, but I just wanted to go over it here again since we're going to be seeing it through the rest of the topics. DSM-5 stands for the Diagnostic and Statistical Manual of Mental Disorders, published by the American Psychiatric Association. Its uses are to like a general understanding of the condition, direction for treatment. It's used to define the severity of the disorder, and also for medical insurance or reimbursement of services if you're a clinician. So the importance is to list disorders and their diagnostic criteria foremost, or what it's going to be mostly used for. Also, it helps define those distinguishing factors between disorders. It has also has useful information on the prevalence of disorders. It's updated regularly, and each new edition brings new information, new terminology, and controversial topics. It's kind of a common language between clinicians. And for example, about controversial topics, in the DSM-3, homosexuality was considered a disorder, and now it's not. Here are my sources. Thank you for listening.